All right. Massive attendance. All right, so usually there's. All right. So. Okay. Hi, everybody. My name is Jacqueline Yakoski. I am the vice chair of the Community Engagement Committee for the Nearest Area Commission. Thanks for joining us. Autumn, the chair of the commission, couldn't be here tonight. She's the vice chair of the entire commission, but Harris. He is here too. We're all going to listen to a couple presentations. First from you, Susan. So, Susan Taylor, is that how you say your last name? All right. You're going to be talking to us about the Adam H. Levy, and you have some nice handouts for us that will up there. So thank you. Annie Curtis from Columbus Public Health should be joining us hopefully for a discussion about mental health, and Munir Lynch, the school board candidate, will be here to give a brief 7 to 10 minute presentation about who he is and to accept questions. All right. So thank you for being here.
Yes, thanks.
Excited to hear what you have to share.
So do I just sit here?
Yeah.
Sit here?
Yeah.
Okay. Well, good evening. I'm Susan Lewis Kaler, and I serve as president and CEO of St. Vincent Family Services. It's right in the neighborhood, right down. I feel like we know each other. Do we?
Probably. I've been volunteering for
Forever?
I used to work at.
Oh,
you
yeah.
probably seen me at the
Yeah.
Adam Board system.
Yeah.
meeting,
Yeah.
representing the CNC.
Oh, yeah, probably. Good to see you. Yeah.
Well, actually, sorry, on that note, I forgot like the best part of this meeting, which is we all go around and just say our first names, and then we think of like, what, I'll think of a fun icebreaker question. Oh, man. This is maybe the hardest part. I never am the one to do this, but it's October now.
October.
We did
ask about Halloween.
I know, that's what I was gonna do.
Oh my
We did
goodness.
just broadly ask about like summer plans or like weather plans, being outside and stuff, what are we looking forward to, but it's October, so anybody doing anything spooky this month, and if so, what, where, with who? Okay, you wanna start over this way?
Okay. Nathan Harris, the chair of Nearest Area Commission. Good to see you. And spooky. Spooky.
Or see,
Or just
festive.
well, what's spooky is having to rake the leaves in my mom's backyard. That's always a spooky thing I have to do around this time of year, going into November for sure. So that's my spooky thing for my answer.
All right, that's a good interpretation of the question.
There you go.
All right, go ahead.
Hi, I'm Lynette Shaw Davis. I live in Bronzeville. I'm in recovery, so see me around. I'm a recovery advocate. I don't do spooky. I was traumatized by a scary person at college, at a haunted house. I was really traumatized. It's so embarrassing. I was really embarrassed. So I'm still, all these years later. I am trying to figure out what my husband and I are gonna do for, we, like these days, our kids are grown, but usually like we have something at our church when we dress up, and so it's hard, you got the church, so you gotta have something, it's really difficult to have something appropriate for, so I don't know what we're gonna do this year, because before we started going to church, we had some great costumes, but it's getting harder and harder every year now to come up with something, so. Been racking my brains trying to come up with something. It's not scary, but, appropriate for church, it's really hard, so.
Definitely a challenging.
Yeah, one year we won contest, Pebbles and Bam Bam. I was bamboo. That's not gonna work. We were plugging sockets, you know. He was the plug out the socket, that's not gonna work. So, we can,
Well, we have trunk or treat at St. Vincent Family Services in the neighborhood. So if you wanna do trunk or treat, we don't do anything too scary or devilish either with the kids, but yeah, we'll do that.
yeah, well, I think 2 years ago, I just made like a queen costume, I was like, Queen of Sheba, and he was king, whatever the king that was. He did the baby. So we did that, you know, he had an African thing, so we'll probably do that again, so. But that sounds like a good idea, we'll probably do something like that. I'm glad you said that. Yes.
All right, well, thanks for sharing. Which way do you wanna go, like out and around?
I'm Susan Lewis Kaler, and I work at St. Vincent Family Services, which is right at Miller, Kelton, Broad, and Maine. And I'm here to talk about the Adam H. Levy, but also to remind everyone of the services we have at St. Vincent for youth and families. And the spooky thing I'm gonna do is trunk or treat with our kids who live with us on campus in our residential center. We'll do trunk or treat.
How are you? Good.
So first one, found you guys on Facebook last night, and I was, oh, just come.
Oh my gosh, great, thank you for joining us.
Smith, the first one.
Do you live in the area?
I do PR for Brownsville Neighbor Association.
Awesome. Okay, but it was even cooler that you came. Thanks for joining us.
This is Lily. I'm Alfred, and we live in Bronxville. And so we throw a party every year called November Week, the first Friday of November, so that we don't compete with other Halloween activities and people want to, bring their costumes out one more time. Or enjoy putting up Halloween decorations while everybody's putting Christmas decorations up, or listening to scary music while people are listening to Christmas carols. Because some people do that. Like as soon as Halloween's over, it's Christmas on the radio. So one last hurrah. That's probably our biggest project.
That is such a cool tradition.
Yeah. And you can buy all this stuff on clearance
The
the day after Halloween.
And all the leftover candy.
Yeah.
Yeah.
Oh yeah.
Very smart.
Right, and we have take the basket of candy out. Right, Dana Dorsey, Program Manager with Partners Achieving Community Transformation, or PACT. And my two key things, I have two, they're not, well, one is kind of scary and spooky. So me, my parents, and my sister, and we do scary movie marathon every year. So that's always fun. We always say everybody has to pick one, but we only make it through like 2. We're old and tired. So that, and then I hold down the fort at my sister's house when my nephews go trick or treating. So I get dressed up and hand out the
I'm Bob Rice, and I'm a district Platinum commissioner. And I bought my house in 2006, and I think the neighborhood had given up trick or treating on my street because probably for the first 8 years we had no kids, which was really disappointing. So what I do now is I decorate the front porch with pumpkins. But unfortunately, as a kid, I was traumatized by reaching into the pocket to pull out the seeds because it's so slimy, and I won't carve it. So that's my unspooky story.
I feel similarly about it. All right, and then and feel free to share something you're looking forward to this spooky season that's coming.
Okay. My name is Erica Neal. I also saw this on Facebook. I floor here for the county partnership services board. Speaking about issue 1 as well. service, big contract, we're starting July. About it. Going forward, as far as looking, we don't have that many, kids on our street either, still partnership. But think they live across the street. We have a family and they, every Halloween, they would decorate their home. I mean, they would go full on. They had music playing, they had animatronics going, yeah, witches, yeah, she would dress up in the kids. I mean, I just really missed that when I was little. But yeah, they moved, so, I do remember that, and that's not Kennedy, it's something I look forward to, but, I don't think really just, I don't want to talk with spice and all that stuff, but.
Thanks for doing intros. All right, thank you. Well, I am here to talk about issue one, the Adam H. levy. We are proudly funded by the Adam H. Board of Franklin County. We're also funded, we also are Medicaid funded as well as United Way, a longtime affiliation with the Adam H. Board of Franklin County. And I did leave at each table and then on front flyer. We are right here in the neighborhood at St. Vincent Family Services. The primary client that we serve is always a child, but it's children and families. So we do same day access for anybody who needs help can come in. And we have a federally qualified health center with OSU. Anybody in the neighborhood, anybody in the community who needs primary health care is welcome to come in as well. So we're really excited about that, and we're going to have a grand opening in the middle of November. So I'll send out, and so we're going to punch list, but as soon as we have that confirmed, I'd love to send it out to this group too. Yeah, thanks. So issue one is so important for our community. The Alcohol, Drug, and Mental Health Board is the entity, the county entity that is responsible for funding, planning, and evaluating mental health and addiction services. And they contract with a network of 50 agencies. St. Vincent Family Services is just one of the 50. And Linda, I do remember you. I was very active in community and family advisory councils for a lot of years too. I worked at the Advocacy Board, so that's how we know. Oh, yeah. Yeah, I worked there for a long time. So this issue is so important to our community. So if folks are underinsured or uninsured in particular, then all of the services that Adam H. Contracts with for all of the network of care, individuals that are Franklin County residents can receive on a sliding fee scale. Oh, could you, or should I do something?
Oh, no, I think I got you.
Oh, okay, thanks.
Let me know when you're ready.
Okay, yeah.
Okay. Yeah. Okay.
Oh, there we go. I just did that one. I'm sorry. No. So why is issue one necessary?
Oh, sorry. Yeah.
No.
There we go. Okay.
That's okay. Well, all of us are aware that the federal government shut down today. So the uncertainty with federal funding is real for all of us in healthcare. And Medicaid funding, which is a combination of federal and state, as well as just state funding. We need to have a safety net in this community for people who need care. Our crisis and our issues don't change just because the federal government decides to close down. In our community, like in every community in the country, 1 in 4 Franklin County adults are experiencing a mental illness each year. And the suicide rates are increasing, particularly for teens and older adults and males. We do a lot of outreach around suicide screening and suicide prevention. For us, we do a lot with teen adolescents as well. The overdose rate is still at historic highs. We don't maybe talk about the
the overdose epidemic as much as we used to, but it is still a real issue in Franklin County. And then, of course, the needs are increasing because our population continues to grow in South Ohio. And then I hope you recognize some of these logos. This is some of the 50 agencies that are throughout Franklin County. I think one of the strengths of the Adam H. Board of Franklin County is the diversity of their network of care. And, you know, lots of different folks focus on adults or children or youth or adolescents. Prevention, alcohol, drug addiction, mental health. So we have a very solid network of care. Of course, the Franklin County Crisis Care Center just opened a few weeks ago now, maybe a month ago, a couple months ago. And that has really been a long time coming. And part of the levy request is to continue developing the crisis center as well, which is serving adults in the community. And yeah, and so this is a modest increase, and I say that even a modest increase in this economy is worthy of conversation, right? Because people are still really trying to make ends meet, and the economy is rough for a lot of folks in our community. We are requesting an increased millage in property taxes in order to meet the increased needs and just the growth in our community. So the total millage increase for issue 1, the renewal is 2.85%, 2.85 mils, and then the increase is 0.5. And that, you see that chart, it talks about the increased millage is about $1.46, and the total millage that we will be asking for November is $5.74 per $100,000 value of our.
When people are voting yes, they're voting yes to the renewal and the increase.
That's right.
So if it doesn't pass, that means the 285 renewal is also gone.
That it will be, everything will be disapproved, and then the Adam H. Board would have another opportunity before it stops collecting to go back in spring, is my understanding, if they would need to. So it hasn't completely expired yet. This is the first kind of opportunity, though, to vote on it. It wouldn't start collecting right away.
But there's no like, since it's a yes or no vote, there's no like yes to sustain that renewal amount or yes to stay and increase. It has to be increase or not at all.
That's right. And it's a really good question. The way election, these kind of electoral votes work in Ohio is it's a yes or no.
Yeah.
Which is why you have to at least start it in November before it expires, so that you would have one more. Conventional wisdom would be, if it's voted down in November, you probably go just with, you know, something less. But 77% of all the funds of that 50 agency network, 77% of all the funds come from this levy. So if that went away, the new crisis center would be at risk. All 50 of us would be at risk because the state monies that flow into our community and the federal monies are the minority percentage, 77% are local funds. Yeah, it wasn't always that way. But that is what it's come to. And yeah. So we are really reliant on this county levy to provide for the safety net in our community.
So the monthly breakdown, 574 is over a period of how many years?
This is a 10-year levy. And this request is 10 years, which we believe it's a modest increase, but it's needed to stabilize realize for this next 10 years, no one knows what is gonna happen in the federal side, whatsoever. And so this will provide for the brand new crisis center and all of the community-based, investments, for folks to be served in the community.
So just to make sure I'm understanding the math.
Yes.
It's 285 plus a 0.5% increase per $100,000
Yep.
value of home.
That's right.
So if I have a, hypothetically, say I have a $600,000, hypothetically, I don't live in Miami. But, it would be 574 times 5.
That's
Or
right.
times 6.
Yeah,
Right.
that's right.
For the next 10 years.
That's
And even
exactly.
if the value of your home goes up, is the price which you're being charged go up too? Or is it just set for?
So that's a really interesting question that is being debated right now in the legislature about renewals versus replacements and how property taxes are renewed or not once they're set. Right now, if this were to pass the way the laws are right now, you could have 10% more homes that come into your district, for instance, in an area that's developing. That would lower everybody else's tax rate, right? Because you're never gonna pay more than what was at the vote. It would actually, that's the maximum when you pass that you're gonna collect. And so if you have 10% more houses, it's spread out. That is the current state. I only say this because there are all these reports coming out of the legislature and the governor's office about all these changes to the tax structure and how levies. So I'm kind of trying to learn myself, how might that change with any of those decisions the legislature makes. So 10 years would lock in the amount, you would never pay more than, the levy would never collect more than when it's set, when you vote on it.
So however much my home is worth now, as you just said, is how, like, is what I would apply to this application. That's how much you know.
I think whether it's a triennial review or whatever whatever the frequency is of the county, I'm not sure how these new proposals are going to interact with that. I really don't understand that.
Yeah, we really don't know what the legislature's gonna do for property, tax, adjustment. So, it's kind of a moving target at this point.
Yeah.
But we could build more single-family owner occupied homes on the Erie side.
Sure will too. Interesting. Yeah, I have another question on Bob's point, but it's probably not much of a discussion too, because, if the state does improve property taxes or whatnot, then what happens with this then?
I think we're all like kind of interested in what the alternative is with all these proposals saying we're taxed too high. And I think reasonable people could say that we do need to modernize our taxing approach in Ohio, but nobody quite understands, at least that I know. So what are you trying to replace it with, and how do the schools and everybody else who relies on property taxes to sustain these kind of safety nets? How will that impact? I don't know.
College.
So again, 77% of the NIH funding is in our community. It's all Franklin County, and that would fund the most critical issues like suicide prevention, mental health and addiction, as well as the crisis center that we spoke with. Let's see, this one is, and so just to give you an idea of the volume of services in Franklin County, about 250 hotline calls a day for 988, from 988. I don't know if folks are familiar with that, but that has really grown as a tool to support people in any kind of mental health crisis. We already talked about the network of care, 50 agencies across the community. We're in 16 county school districts that have prevention and early intervention services. We have 6 systems of care: crisis, prevention, treatment, recovery, and then also housing and family supports. And 5 mobile crisis teams that work alongside law enforcement and public safety. And then the newly opened crisis care center. So really, that is kind of a safety net that continues to be in place. I think the strength of this proposal is it being for a full 10 years, which is vital to being able to stably fund healthcare at the community level, and then a modest increase as well for the agency. I would be so happy to answer any questions. At least I'll try.
Well, I have one question.
Yes.
I've never understood what Adam H is,
Yeah.
and I lived here since 1981.
Yeah.
So what I think I'm understanding is Adam H funds
Yeah.
different agencies to provide direct services,
That's
and
right.
itself does not.
That's correct.
Okay, all right.
Yeah, in Ohio, the Adam H award system, and sometimes in counties, 88 counties in Ohio. The last time I looked, there were about 55 boards. It used to be that started off as either mental health boards or alcohol drug addiction boards. Then as we really have moved more into behavioral health care, integrated whole person care, mostly they're Adam H boards. But this all came out of deinstitutionalization and the movement to take care from an institutional level and to be able to fund community care so people could get the care. So that's been around for a very long time. Are we? Yeah. I think many people would say that the vision of deinstitutionalization and providing care at the community level was never fully funded and actualized. I think that we still need more supports at the community level if we want to keep people out of the hospital and out of the highest level of care. Being in communities and neighborhoods and being where people want to live in their homes and their communities, it's not only less expensive, but it's where people want to heal and recover. But without this local levy, we would be limping along because the state and federal government really doesn't provide the resources that we need in a community of this size.
So the other question I have is, I know that Children's Hospital was recently built behavioral health hospital. So does Adam H fund agencies that help children transition from the hospital?
Yes. Yes, we would be an example of that. At St. Vincent Family Services, the #1, we get referrals from all across the community, families, grandparents, schools, but our #1 referral source is either stepping down from the behavioral health care pavilion, or actually even their postal home centers trying to do, appropriate community level care. So it's either to keep people out of the hospital or it's to step down from a hospitalization.
Thank you.
Many agencies like us, though, are working with Nationwide Children's Hospital.
Have you, by chance, just know that there's a primary care clinic right up the street on Main? Have you ever done any work with that?
The Nationwide one?
Yeah.
Yeah, we send our children there all the time, the kids who live with us. And then they send their children and families to us as well. Because continuing care with a therapist or clinician is something you need an ongoing support. So we get a ton of referrals. They're a really good partner.
Do you provide services to LGBTQ agencies?
agencies.
Like Kaleidoscope.
Um,
Because they have kids that drop in, but they don't provide, I think, mental health services at all. And
yeah, I don't think Kaleidoscope is one of the network providers, but I know that they work on community education and outreach for sure. I don't see them on their network of care, but I do know they do community planning work for children.
I scanned the QR code on the screen, and I love that it gives examples of ways that you can volunteer, learn
Okay.
more, share this information. I think that's really great. So if you're interested in learning those things, guys, I recommend getting the QR code. But of the listed opportunities, would you say that there's a higher need for some rather than others? That makes sense. Obviously, if people can participate in any capacity, that is helpful. But what are you guys thinking?
I think if Jill Frost were here, Jill Frost would say, we're right now looking for people to do phone banks and to volunteer and to have yard sale, signs. Yeah, I think I've gotten the most emails lately from Jill, who's been a long time organizer of Adam H. Levies, in the community, so I think I've got more from her on that.
That's good to know as I peruse the options and see how I want my engagements. Yeah.
But thank you, this is really important for our community, I appreciate you doing that.
Thank you. Thanks for being here. I learned more about a lot of things. I know I said it's some preliminary, but what is the most things of what, like I know that was the.
Yeah.
That's good, that we talk about.
Oh, thanks, thank you.
Are we allowed to share these slides?
Absolutely.
Yeah.
Yes.
I cannot, my memory is so bad. I've been called. She's vice president, she works with the Bay community.
I don't know, but Jill would.
She worked with Jill, she still talks about it. She was consulting on with the project.
Oh, you think of Rochelle Martin?
No, not Michelle. She was working at St. Vincent,
Oh,
but she was working with the Faith Project.
Regina Haynes? Regina. Yeah.
Yeah.
Yes,
She's still a Faith.
she's still, yes, actually.
Yeah, I will talk to her.
I will.
I told her I'm gonna reach out to her.
Okay.
Faith
Okay,
Community Project.
okay, I will. Yeah, okay. I knew she was going to come. Thank you.
Thank you so much for
Thank
being
you.
here. We appreciate it.
Thank you. Retired is not forgotten.
I'm not retired at all.
I can't even remember where I was from. Well, they changed the name, so.
Oh, that.
Yeah. Changed the name.
Oh, I don't think our other two presenters were able to join us.
Oh, somebody went to school.
Candidate, and then Annie Curtis from Thomas County Health. Wow. Questions for anybody? I mean, I'm not the one who's gonna have answers about this, but we can crowdsource it.
Next month, we'll have Michael Leggett, who will be presenting on the neighborhood slow zone project. It's been a year-long study on for the fast areas around, particularly Near East, and they did in-person open house style. We come in and mark these zones as high speed, and they have different suggestions, like you want a roundabout here, you want light up crosswalks, things like that. So they are going to come and to share some of those preliminary results of that neighborhood feedback that they did. There's also a survey that's still active, so if you'd like to participate and to give your suggestions, we did send that out via email. I think it's on our Facebook page as well. So you can definitely still send that out. I got an email the other night saying they're speeding down whatever alley. So I said, well, put your feedback here. So they'll be coming. And then next week, we'll have our general body meeting. Should be an exciting one. We have speaker, Representative Humphrey will be coming to speak. Then we have our four projects, one of those projects being solar towers. So yeah, so that is next week. You all have fun with that. I won't be here. I'll be up the street, but I won't be here. I'll be here in spirit. I might try to leave the event early if I could, but yeah, that will be it. So we're gonna talk about that on next how what's the control over time. Because you know it's not from us, people are not show up. People are not show up. You know, so again, on behalf of the Madam Vice Chair and then even the Vice Chair of this committee, Dr. Kowski, I thank you all for coming. And we'll be back here November 6th, 2 days after Election Day, with Michael Gibb. And I think just saw an email from zoning that they're going to come give their next date.
And I would like people to, if you live in District 1,
Oh, yes.
which is mostly Bronzeville, we won't get into that discussion. We're having a big table conversation on October 21st, and our topic is from the Area East Area Plan 2005 and into the future. So we'll review some of the current plan and for what they want going forward from this point forward. So it should be a fairly interesting discussion.
You said that's District 1 specific.
Yes.
Well, it's open to anybody, but it's just the District 1 meeting.
And District 3 and 4 are having a big table too.
Yes, 3, that was on the same day, I think, at the Grand Ryan Center.
Yeah.
That's what I was just pulling up. Just
Yeah,
make sure I say the right.
it's sponsored by the Research Foundation, so it's supposed to be, every big table event is supposed to be on the 21st, it's that, 7 p.m.
It's on the 20th.
That's
Ours
around the
is-
time for you.
Yeah, I don't know that ours is the big tables.
There is a.
Ours is not.
There is, yes.
Oh.
But our, so you can finish now.
No, I'm done.
Okay, the district,
It's, it's at Broad Street Presbyterian Church in Palmer Road. Mm-hmm.
You said around,
7 o'clock.
And we'll definitely send this out via the email listserv, and we'll put it on social media as well. For District 1's big table, and then Kowski, you announced District 3's meeting.
So District 3, we'll be having our meeting on October 20th. Here's our little group, so we'll be coming together to get to know each other, but also to talk about building community partnerships, specifically with the Columbus Foundation's Kindness Close to Home program. Yeah, this is gonna be at the Fran Ryan Center, just like off, like between Broad and Oak.
Behind the BP station.
Behind the BP, yeah, that's where that is. It's a beautiful center. If you haven't seen it. Yeah, that's Fran Ryan. Yeah, it'll be at 6:30 on the 20th. Right. District 3 is from, so it's east of 71, north of 70, and all the way to Broad on the north end, and then Wilson on the east end. So like kind of a square made with the two freeways, Wilson and Broad.
Then just,
Everybody's welcome though, regardless of what district.
and these district meetings, to give context, each commissioner, there's 4 districts within the 1, 2, 3, and 4. 3 commissioners represent each district, and then there's 3 at-large positions, and so each commissioner is basically to have their own meeting with neighbors, constituents, and so forth. This is to have a public meeting with them. It can be a discussion, it can be as formal or informal as it can, but just as a way in which commissioners are showing effort of actually reaching out and being engaged in tune with neighbors and so forth. Then District 2, they just solidified their meeting today. Yes, it will be November 5th, the day after the election, starting at 6 o'clock, and their topic is on financial literacy or something. Financial wellness presentation. That is what it's over. Do not ask me the context of it, but financial wellness is what they're talking will be about. That's November 1st, I guess it's next month, but yeah, so 1, 2, 3, and 4. We're pretty much rounding out the base. And then if you know anyone who lives in District 2, there are currently 2 seats open that you can apply for, or anyone that you might know that might be interested in serving on the commission. There's 2 seats available.
Are they commissioners?
They're commissioners. There's District 2 seats, 3 and 4. So there's 2 in District. And these would be 3-year terms as well. So know anyone that lives within those boundaries, and those boundaries can be better visualized on the website. Please do encourage them to apply. It's a non-paid seat. Put that little note out there, it's not paid, but you pretty much do oversee the planning and development of this very community.
Cool.